system. Joining us now, the senator we just mentioned, Senator John Thune. He's chairman of the Senate Republican Conference. The wait times, Senator, for help, for, patient care at VA clinics, how long are they? Do we know?
That's what we need to find out, John. The one thing we know is this is a national embarrassment. These are the people who lay their lives on the line for us, the people who risk everything. They deserve better than second-class health care treatment. And what we're finding out is that this is a systemic, administration-wide problem. And in order to get the full dimensions of it, I've got a bill that asks the Inspector General to do an investigation and in 6 months to report to Congress so that we can fully fix this problem. But this is not an isolated, a one-off thing. This is something clearly that is systemic, needs to be addressed. The administration so far, the president, finding out about it from the news media, you have to start asking the question, where's the accountability and where's the responsibility to take care of those people who have literally laid their lives on the line for us?
I know that part of your bill, part of your legislation would allow the closing of VA facilities that aren't getting the job done, but if you've got substandard care and you've got long wait times now, how would closing a facility do anything but exacerbate the problem?
Well, and that's actually what the legislation says, John, is they can't close facilities until the completion of this review, and then we'll make a determination about whether or not closing a facility would cause a deterioration in care for our veterans. And if that were to happen, if you were going to see additional delays or denials of service, then they wouldn't be allowed to close facilities. But we don't know all that, and the only way we're going to know that is if we have a full-blown investigation of this problem. And it's something that the administration, when they had the problems with the website rollout, they threw hundreds of millions of dollars at it. They said all hands on deck. Well, that's the kind of approach that we need to this issue. These are the people, the men and women in uniform who have served our country with great courage and distinction, and to have them come back and to be exposed to these kind of problems at their health care facilities is just an outrage. And it is. It's a national embarrassment. We ought to take this very seriously, and if the president's not going to, we in Congress are.
Dr. Robert Petzel was the top medical officer at the VA. He announced, or it was announced on Friday, late in the day last week, that he was resigning. Essentially, he was the face that the administration, I guess, got as sort of the scapegoat for all this. It turned out he was resigning in a month anyway. But what do you think about the way the administration has handled this? Who's responsible? Who's in charge of the investigation?
Well, it needs to, at least initially, John, all they did is they assigned one staffer at the White House to go review this and look at that. And I think it's a lack of seriousness about a very, very serious issue. And the fact that Dr. Petzel's resigned, he was resigning anyway, they've already named his replacement. There's a bill that the House is going to debate tomorrow. It's a version of a bill that Senator Marco Rubio has introduced here on the Senate side, which would allow the VA to terminate high-level people if they're not getting the job done. That's something that in the private economy happens every day. If people fail at their jobs, they get fired. Well, you can't do that at the VA. And things have got to change, but it's going to take a focus, an increased focus from the administration, from the president, and his team. And so far, that hasn't happened. But there's getting plenty of discussion up here on Capitol Hill. We're looking for things that we can do that will actually address this crisis. And obviously, we think it is a crisis, and it's not just an isolated crisis. It's a systemic crisis throughout that entire system that's got to be fixed.
Yeah, so many veterans. We owe them so much, and if they are not getting the care they deserve, it's a real problem. Senator John Thune, Republican from South Dakota, thank you.
Thanks, John.